start. So we have confirmation of a quorum. Thanks everyone for attending the July meeting of the Housing Policy Advisory Committee meeting. Has a press release been sent out?
Yes, it has.
All right. If we could go around the room and if people would introduce themselves. I'll start. My name is Bev Merrill. I am from Covington and I work at Welcome House of Northern Kentucky in Covington. We serve the Northern Kentucky Balance of State region, and I represent people who are homeless on this committee.
Dave Crayer, People's Self-Help Housing in Lewis County, and I'm the HPAC Secretary.
Logan Haynes, Kentucky Manufactured Housing Institute.
Christina Espinosa with the Human Development Institute and represent accessibility and universal design.
I'm Jason Dunn. I'm the director of the DCBS Division of Family Support. I am proxy for Secretary Freelander of CHFS.
This is Zach Worsham with Winterwood Incorporated.
This is Lonnie Campbell, Kentucky Association of Counties.
Cassie Hudson, Executive Director of Partnership Housing.
Wilma Kelly with Baitable Housing and Development Corporation.
Lona Brewer, proxy for Secretary Rebecca Goodman of the Energy and Environment Cabinet.
Becky Willis, River City Housing, representative of housing developers.
I'm Mary Crowley-Schmidt, Bluegrass Area Agency on Aging and Independent Living, representing the area agencies on aging under the umbrella of the ad districts.
Rob Jones, Audubon Area Community Services here in Owensboro, I'm sorry.
Scott McReynolds, the Executive Director of the Housing Development Alliance in Hazard.
Buddy Kittle, representing the Mortgage Bankers Association of Kentucky.
Barry Nolan, I'm a utility representative from Kentucky Power. We serve Eastern Kentucky.
Anyone else?
Yeah, Craig Brock, Bill Whitley.
I'll start the KHC introductions. Bev, Wendy Smith, Deputy Executive Director of Housing Programs here at KHC.
Kate McAfee, Housing Policy and Program Administrator here at KHC.
Kelly Reynolds, Assistant Director, Single Family Production, Kentucky Housing.
Christine, you were on mute. I don't think we heard you.
Christine Ambergy, I'm the Eviction Diversion Program Manager here at KHC.
Anyone else? Welcome to all. I think that's one of the smoothest introductions I've ever heard on team. I think we did a great job. We're getting too good at this. And Carla, let me ask you, did anyone from the public wish to raise any issues not already on the agenda?
No, there was no one.
All right. So next, we have an agenda item labeled administrative items. And Carla, I am not sure what that is.
We do not have any administrative items on this meeting, at this meeting, Bev.
Okay, all right. Well, that's helpful. If everyone could review the minutes, please, to see if there are any corrections or additions. And if I could have a motion to approve the minutes.
So moved.
I'll make the motion to second, Wilma Kelly.
All right. All in favor, please say aye.
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 Opposed? All right, the minutes are approved. Next, we have Ashley Runyon, who is going to present on the complexities of energy affordability in Kentucky. So welcome.
Thank you. I appreciate it. I'm going to try to share my screen and see if that works. Hopefully it will.
Hey, you will need to stop sharing your screen so that Ashley can share hers.
Are you all able to see my screen?
Yes.
Yes.
We are. You might want to go into present. You're good. Yeah.
All right. Perfect. First, I'm just going to introduce myself and thank you all for allowing me to take a few minutes to touch on this topic. My name is Ashley Runyon. I'm the Assistant Director at the Office of Energy Policy. And the reason why I came today is because I'm really excited to just sort of share a little bit more about what I've learned over the course of the past 2 years. Prior to coming into this office, quite frankly, I did not have the knowledge base that you would think someone would coming into the Office of Energy Policy. I came from the Cabinet for Health and Family Services. I was an advisor in the Secretary's office and pretty much advised on vulnerable populations, mainly in regards to children. Before that, I was hands on the ground, a family resource coordinator in the public school system for many years. And in that time, I think one of the hardest issues that I dealt with was in regards to energy affordability. It felt a little bit less challenging to connect people to resources with food. It felt a little less challenging to be able to connect to resources in regards to housing. It didn't mean it was easy, still extremely complex. But when it came to energy, it just felt a little bit more difficult, a little bit less understood. And so this has been a wonderful journey in my career to have the opportunity to understand this better and hopefully share so that we can holistically come up with sort of solutions for the people that we all serve together. I'm going to try to see if okay, there we go. So the Office of Energy Policy, I'm not going to read all of this to you guys. We are not an office that regulates. We do, however, look at policy in a holistic manner. The goal is to ensure that our citizens have the ability to afford energy reliably. And so we work diligently with all of our partners to continue to move Kentucky forward. And that also includes workforce development. It includes, again, resiliency, working with existing energy systems, as well as looking at new opportunities as we move forward. So kind of just as we get started, this is going to be information that I assume most of you guys are somewhat familiar with, seeing as though we sort of all work with the same populations. But I wanted to level set in just a way to kind of let you all know why the issue of energy affordability is so important, specifically in our state. Kentucky Youth Advocates, many of you I'm sure are very familiar with this group. They have a Kids Count data book that comes out annually. And this year it showed that 45% of our kiddos are living in low-income families, 20% are living in poverty, and additionally 17.9% of children are living with food insecure households. The Department of energy published data that shows an average Kentuckian spends 3% of their income on energy expenditures. But when we look at those households that are up to 60% of the area median income, they're at an average of 11% of their income on energy expenditures. And quite frankly, in the eastern parts of our state, some counties in the western parts of our state, those numbers actually go up to 16 and 17%. And when you're looking at household expenditures, you know, an average for a family in Kentucky, 3%, but then our low income poverty households, their energy expenditures 16 and 17%. That's not acceptable. It's meaning that they're having to choose between energy needs and food needs or medicine. In 2019, and again, these are just the latest numbers that I have. I need to pull some newer ones, but 2019 Community Action Kentucky reported that 176,339 applications were approved for utility assistance. I do not have the weatherization numbers. You guys, I'm sure, do though. And then through the pandemic, we know that these numbers have increased substantially. Kentucky United Way 211 contact centers are currently reporting their data out of 3 of their regions, and the Bluegrass region reports that 21% of their calls are for utility assistance, Metro region 18%, and the Southern region reports 30%. All 3 report that higher numbers for utility assistance than food. Again, that sort of goes back to, I don't think that the need for energy is necessarily more than the need for food or housing. It's just connecting to resources for energy is substantially more challenging, I think, to our vulnerable populations. So again, I'm speaking to a crowd that's very familiar with all of this, but when you're looking at Maslow's hierarchy of need, and the goal is that we're empowering the populations in which we serve, and we want to make it to the top of this triangle, which is basically where people have the ability to realize their, you know, full self-actualization, their full potential. And in order to do that, you have to, you know, the way that Maslow's hierarchy of need works, you have to fulfill each level to get to the next. The very basic bottom is food, water, warmth, rest. So housing, food, water, warmth is where the energy part comes in. Also, you can't get good rest if you're not in a dwelling that has, you know, good air quality or temperature. And so I think it's just important that we're looking at energy needs just as, you know, much a basic part of this triangle as all of the other needs included. Just another thing to kind of back that up, social determinants of health, pretty much, you know, when you look at life expectancy and healthcare expenditures, and you kind of take a look at each one of the 6 of these columns here, several of them would suggest that energy falls into play. And so that's going to be your expenses, right? Economic stability, and energy for a lot of people is one of the top expenditures, you know, next to their housing that they face every month. You go over to food, and if you're struggling to pay your energy bills, then that can affect the amount of food that you're able to purchase. I'm not going to go through all of these, but I think I'm just trying to drive home the fact that, you know, the ability to have affordable energy is crucial for all the people that we serve. So then we look at defining energy affordability. People look at that very, very differently. And in the state of Kentucky, we don't have a universal definition, which is okay, but it is important that we're all sort of having a good understanding. So cost effectiveness is a measure of the investment in the energy system or program compared to the outcomes it generates. That's more of a technical utility sort of definition. Then energy burden for myself and the work that I do inside of our office is really what I look at the most. And that's the percentage of income spent on energy services and commodities for a household each month. Energy insecurity, many people would look at that as, you know, when we have a weather crisis in our state that would cut off utilities, something of that nature, but it's also someone's inability to afford their energy resources, then, you know, causing their energy sources to be cut off because of their inability to pay. And then additional factors that contribute to energy cost and, you know, weatherization, which is, you know, energy efficiency upgrades that reduce the amount of energy needed inside of a home, the mechanics and systems inside of that home, which also affect the amount of energy being used, and then home repair and disrepair. So this is just an example of two ways in which people can look at energy affordability. On the left, it's just downright cost. How much is your utility bill, period, end of story. And then on the right, that's energy burden. That picture was actually a screenshot. It's not super, I did not pull it today. It's actually quite a bit. It's a little over a year old. The numbers have not changed that much, though. It is coming from the low income energy affordability data tool. But if you look at the far right-hand side of that, that's showing you that families up to 60% of median income for our state, that's where that 15 to 17% energy burden number I was talking about. That's very substantial. It gives you kind of an idea of how our state's laid out in regards to energy burden across the state. So again, another thing that comes huge into play in people's ability to afford their energy bills is weatherization and home repair. And I assume most of you guys on this call are well aware of the complexities of the weatherization program, and you know, knowing that basically 2 out of every 3 that apply for this, based on the federal way that it's written up, actually can't partake in the weatherization program at all because their homes are in such disrepair. So that's a huge gap that our state has to work to fill. Mechanics and systems, and how much is it costing to run different systems inside of the home. I'm just going to go through these really quickly. So our role inside of our office is to provide technical assistance, which we're happy to do so with anyone inside of our state, whether that be a business, a nonprofit, another government agency, administer grant programs across the Commonwealth to support the state's energy goals. This is huge for us. If you know there is something that needs to be solved inside of the county or region that you're working on, our office does have the ability to work with, you know, other government entities, educational institutions, nonprofits to really fill these gaps. And so I would encourage you all to come to our office with those. We monitor, track, and analyze energy data, and I'm going to share a little bit about some of the data that we've been collecting to hopefully help those of you guys in the state when you are making decisions as far as grants or where dollars are going, or how we can solve some of these problems. And then also increasing energy literacy, because we know that when people have more knowledge about how they're using the energy inside of their home, they have the power to reduce those bills themselves as well. So I don't know if this is going to let me go to this dashboard, but I am going to try. We worked with Kentucky Stats, and many of you all are probably familiar with Kentucky Stats. They're a fantastic resource, and they helped us put together this energy affordability dashboard. Oh yeah, can you guys see that?
We're still seeing the website address.
Okay.
So you would just need to share your entire screen instead of just the PowerPoint presentation, or switch your share to your web browser.
Let's see if I am technologically inclined enough to do this. I'm going to try again. Can you all see it now? There's 2 maps of Kentucky.
Yes.
Perfect. Okay. And how am I doing on time? Trying to fly through.
I think you're good on time.
Okay. So we had Kentucky Stats work with us this past year, and I will say that this is sort of our first run at this. The idea is that we will have the ability to work with additional partners in the future to gain several different, I guess, drop-down categories and break this down further, make it more accurate. Some of the data that we're using is census tract data, and we would really love to have stronger data from state sources that keep, you know, better data than that. But again, this is our first run through, and the goal of it is really to allow other people that want a better understanding of energy burden in our state to sort of thumb through. So for instance, since we are, let's see. We will look right now, and I'll give you an idea of some things that you can do with this. If I were to pull down, and let's just say we'll pick an Eastern Kentucky county, and we were to pull the Pike County profile, you can pull down and look at your county specifically, and you can see the electric bill trends, which is just the outright average cost. You're able to see the other fuels trends, and then you can take a look at the average energy burden for the entire county. You can look at things such as the median household income. Something I personally have really been honing in on is looking at the housing stock. And in Pike County, 36% of the housing stock there is mobile homes, 55 is detached. But if I was looking at what kind of programs I was wanting to do in Pike County, then clearly I would want to look at something that's going to benefit those that live in mobile homes. Looking at the years that the housing were built, and you can kind of layer that over top of burden for different counties and sort of understand how housing stock is correlating with energy burden, how housing years are correlating with energy burden. You can play around with it, pull down again, poverty level. You can look at places that are only using heating as electric, only using heating as gas. And this is really just going to help you look at your counties that you're serving and how we can better serve the households inside of those counties. I am going to switch out of this. Let's see, I can figure out how to do that. I think I have to unshare and reshare to go back to where I was. All right, can you guys see the PowerPoint again?
Yes.
Okay, perfect. So moving on along, some of the things that we're doing inside of our office is, again, any way that we can help with the technical assistance and understanding the data for our state, and that energy affordability tool was one. We have an energy affordability work group, which has been fantastic in pulling together people from different sectors in the state that are all really serving the same populations, because we know that serving vulnerable populations really requires holistic solutions where we're breaking down silos. And us over here in energy, we're really glad to be sort of joining the party a little bit stronger than we maybe have in the past. So we do have this work group so that we can learn from others and figure out ways that we can better assist. There's a manufactured housing initiative that is just kicked off with the Department of Energy. And so, of course, working together with all of you on this is going to be important. There have been updates made to the mobile home efficiency standards, and it's looking as though the increase of those is going to average a $475 savings per year to those that get into that. But the question now is, how are we going to get people into these new homes? And that's going to take all of us to figure that out. Loan solutions, and how are we going to, move existing manufactured housing off of current sites? And I think that's really going to take being creative and leveraging funds that we know are coming down. How are we going to get homeowners, again, into these upgraded homes? But then secondly, how are we going to work with those living in existing manufactured homes and repair them so that they will be ready to be weatherized? And I think that's something that, we can all work on together now that we know we have this large pot of funding coming down. But again, that's going to take really having a lot of discussions and maybe some unique out-of-the-box solutions. And so what can, everybody on this call do? I think it just starts with having conversations about energy affordability with your colleagues and how that really is part of the holistic solution to affordable housing. Also identifying if there's an area that you'd like to focus on personally. Is that something having to do with, again, the manufactured housing initiative? Is it on education? I think that everybody has the ability to sort of choose what area they would like to focus on. And then reaching out, we absolutely want to partner with all of you all, whether it's, you guys informing us of things that would help us better do the work that we do, or seeing if there's ways that we can explore opportunities together. Because I think all the issues that we deal with across the board are extremely complex. So I'm excited about the fact that I've had the opportunity to speak with all of you guys. Hopefully you learned a little bit, something new. And if there's any resources that I can help you guys with, if you're interested in the dashboard, would like me to walk you through it at a later time outside of this call, I'm happy to do so.
Thank you very much, Ashley. Does anyone have any questions or comments?
Hey, this is
No,
Logan
and-
Haynes with the Kentucky Manufactured Housing Institute. Just a touch point on the energy efficiency. Obviously, we're watching that pretty close. So if there's something we can do to help on that, we'd love to partner with you.
Absolutely, yes. You will likely be
right.
getting an email from us.
This is Wilma Kelly. Do you anticipate some of the funding that you're talking about to be funding to replace old mobile homes?
I can't speak to the fact that it would be to replace mobile homes. I know Lona Brewer is on the call and she might be able to better answer questions in regards to that. But there are, right now, we are looking at different financing options that will be available in the future for people to be able to, access. And that, again, is more Lona's area of expertise. And as far as the IIJA funding, we actually have a website right now on our, or a portal on our website, so that if anyone is wanting to partner with us, potential grants, they can go ahead and submit ideas. We've not been given hard dates on when this funding will become available, but we are already accepting sort of people's ideas for how they might want to work with us. And you can drop that in the portal on our Office of Energy Policy website.
Okay.
This is Lona Brewer, Deputy Executive Director of the Office of Energy Policy. Several of you will probably remember from a few years ago that we actually had a rebate program for Energy Star mobile homes that we worked with several organizations in the state to administer. As far as money for direct replacement of manufactured housing, that is probably not going to be available. But there are several opportunities, things like revolving loan funds, other initiatives that are being undertaken at the federal level. As Ashley said, we're part of a manufactured housing initiative nationwide. So more information to come on that as we get a little further down the road.
Okay, thank you.
Christy, this is Kelly Reynolds with Kentucky Housing Corporation. And just, I do want to say I've been emailing with Kenya Stump, and we do plan to get together and think how we can creatively use our dollars, because we too are getting IIJA money. We call it bill money, but we too are getting those funds. But something maybe for you guys to think about before Kenya and I can get together is, could we craft out some of your funding for weatherization ready to work in coordination with our bill money? And I don't know the answer to that, because right now we cannot braid our DOE, our DOE formula money with our DOE bill money. So I don't know if we could use your money for weatherization ready. But in response to something you said about data, we had roughly, our preliminary numbers are 442 job completions this year in weatherization. We have 440 deferrals. So for almost for every one job completion we get, we have one deferral. So it is significant, the number of repairs that we really need to see. And I don't know if there would be a way we could craft out some of your dollars for weatherization ready, but our bill money doesn't call for any weatherization ready money. Okay. So the only resource we're going to have is our LIHEAP funding to do weatherization ready on that, and that will be limited as well. So just a thought.
Can I ask you a follow-up question on the deferrals? Do you guys track on those deferrals how many of those are single family homes versus manufactured homes? Is that something that could be tracked in the future?
We don't currently. We could track it. Kenya had asked me that same question, and I say we don't track it. The fields are there that it could be tracked. We just don't have a ready report.
Okay.
But it's something we definitely could look into.
That would be wonderful. I think that would be extremely useful.
Yeah, let me see what data, because the fields are definitely there for the housing stock of what type of stock it is. We don't have a report that links it together right now. But that I think we could have a report. So
Also,
let
and
me
I don't
look
know if
into
this
that.
is going too in the weeds, and I won't ask any more of these questions on this call, but looking at the years, because trying to find the threshold on manufactured homes at which like that threshold hits, that weatherizing it and repairing it versus replacing it, like where that threshold is. And I think that we're trying to find that where that is as well.
Yeah,
any
so
data that would assist.
Yeah, I don't know that we track years. We do have to do SHPA requests for anything over 50 years old right now. So we're tracking that, but we have we have a really hard time with homeowners knowing kind of the date of their house.
Right.
So I don't know that we really capture that, but we certainly capture housing type because it's a reporting field for us anyway. So yeah, I probably can tie that back to deferrals and a report for sure. We just didn't have that ready available when she asked.
Thank you again. We probably do need to move along now, but I know later in the agenda we'll be talking about our priorities for HPAC coming up, and I think we'll be able to revisit this maybe. I sure would like to see maybe some little groups or committees get together in between the meetings. So maybe that's something that could happen with the weatherization. So next we have Leah Werner from the Corporation for Supportive Housing.
Hi, everyone. I could share my screen, Kay, if that's easier for slide advancement.
Okay, sure. Let me go
ahead and
push the control here. Yeah, no worries. Good deal.
You all see that?
Yes.
All right, we're in business. Good to see all your pixelated faces. My name is Leah Werner. I work for the Corporation for Supportive Housing, CSH, and I was asked to join all of you today to talk about the Kentucky Supportive Housing Institute. So for those of you who may not know, I know Cassie's on the phone. Cassie, if you want to add anything as I go through, please feel free. CSH is a national nonprofit. We're headquartered in New York City. We just celebrated our 30th anniversary last year. And our mission is to advance supportive housing being that key housing intervention for vulnerable populations like those experiencing homelessness. And our goal is, of course, to improve the lives of vulnerable people who don't have access to housing, people who are perhaps living on the street in a place unfit for human habitation, are overly rent burdened, who have significant challenges and needs. Those are the folks we're talking about. We're also talking about maximizing public resources. When you think about folks who are incredibly vulnerable, have disabilities, disabling conditions, what you see oftentimes is they cycle through very expensive publicly funded systems like emergency rooms, like psychiatric hospitals, like jails. And what you see through this cycling is incredibly expensive, but with incredibly poor outcomes. So supportive housing being that key housing intervention that is far cheaper and has far better outcomes. And supportive housing, the creation of housing, whether you're building new supportive housing or rehabbing a building or turning an old school into supportive housing, necessarily helps build strong and healthy communities. It's also that social component. When you start reducing incidences of homelessness, that in turn is connected to helping build stronger and healthier communities. So for those of you who might be new to what supportive housing is, this is the definition we defer to at CSH. It's supportive housing combines affordable housing with services that help people who face the most complex challenges to live with stability, autonomy, and dignity. What is at the core of this is that access to affordable housing with services is a basic human right that really drives our work here at CSH. A great way to assess assess if a population is a good fit for supportive housing, because supportive housing is not a one-trick pony. Not everybody benefits from this very targeted housing intervention, is the but-for rule. But for affordability, people would not be housed. And but for services, they would not stay housed. So affordability is the keeper of getting into housing, and services is what's needed for folks who have challenges with mental health or addiction. Services is the critical piece to help them stay housed. So there's a couple models that people pursue when they're developing supportive housing. Once again, if it's brand new units or you're rehabilitating existing units, is the single site model. So what you would see is an apartment building going up, maybe a 1-bedroom if you're focusing on singles, maybe 2 to 3 bedrooms if you're focusing on families. And they can be large buildings, they can be small buildings, but that's kind of that single site model. The scattered site model can be a set aside of units in a larger apartment building that has affordable units and or market rate units. I've had development teams who build 4-unit apartment buildings, so kind of a quad concept, and they site multiple 4-unit apartment buildings throughout one community. So that's what we mean by scattered sites. So you can go either path to bring supportive housing units online. What is true, regardless of the scale, regardless of the location, regardless if it's single site or scattered site, are these 6 core components. To be able to call yourself supportive housing, these 6 core components need to be in place. So engaging households with multiple barriers. Once again, this is not a one-trick pony. It's a targeted intervention, really targeting the most vulnerable people in your community who have the most significant challenges that really act as a barrier to accessing housing and maintaining housing. Housing is affordable. That best practice, the industry best practice is folks aren't spending more than 30% of their gross annual income on housing, and that includes utilities. So upon entrance, someone might be bringing 0 income, so that unit would need to be fully subsidized. If someone is bringing an SSI check to bear to pay for rent and utilities, just for some context, SSI in 2022 is $841 a month, which means someone with that 30% rule has $252 and change to put towards their rent and utilities, which is, of course, not enough to actually operate a unit. But that is how we financially structure these units, because we're working with people who are poor. Provides units with leases. So this is a traditional lease that is protected by landlord-tenant law in the state of Kentucky. There's no requirement for services participation. There's no language around medication requirements or sobriety. It truly is a lease like many of us have held in our lifetime. Engages tenants in flexible and voluntary services. Going back to that but-for rule, but for services, people would not stay housed. The offerings of services need to be tenant-centered. They need to be robust. They really need to be able to meet the tenants where they are at to help them stabilize their lives, help them improve their lives, and move to be kind of in a thriving framework, if you will. The last 2 components is really recognizing that supportive housing is different than traditional affordable housing. It really requires the laser focus of property management and services to work together to partner with tenants to make sure that our tenants stay housed. Because if someone is exiting homelessness and moving into supportive housing and they're evicted, where are they going to go? They're necessarily going to return to homelessness. They're 99% likely to return to homelessness. So there's so much efforts in the supportive housing world to work to keep people housed. In fact, that's the #1 goal. The #1 goal is keeping people housed. And then from there, all the other outcomes that we traditionally see come to light. Improvements in physical health, improvements in mental health, decrease in substance abuse, access to employment, et cetera, et cetera. And then supporting tenants to the community at large. We do not live our lives in a vacuum, and our supportive housing tenants shouldn't be living their lives in a vacuum. So really thinking about the people, the places, the natural supports that all of us kind of count on to make a go of our lives is what we're charging supportive housing development teams with, wrapping their brain around and helping our tenants facilitate those connections as well. So it bears repeating this because oftentimes people think supportive housing is treatment. It's not. It's not transitional. It's not licensed community care. It truly is affordable housing with access to wraparound services that are tenant-centered, robust, and voluntary. So when CSH first started working with KHC, we've been working with Wendy's shop there, we did a real deep analysis of all of the homeless data throughout the Commonwealth. And you see this purple arrow there. Over 3,200 households in the homeless system that would benefit from a supportive housing intervention. And that's a staggering number. 1,100 of those households are coming from the balance of states, so those non-entitlement communities, and then over half in the city of Louisville alone. So the need most definitely is there in terms of building out a supportive housing pipeline in Kentucky. So as you just learned, that but-for rule, but for affordability, people would enter into housing, but for services, they would not stay in housing, as the key litmus test about vulnerable populations that benefit from supportive housing. Well, the truth of the matter is that supportive housing as an intervention goes beyond the four walls of the homeless system. It, of course, has been used to end chronic homelessness in communities and veterans homelessness in communities, but there's also a short list of other vulnerable populations that benefit from supportive housing. And you see those numbers. This kind of snapshot was taken about 3 or 4 years now, so these numbers could use some refreshing, but just to give you kind of a general sense about where the numbers are falling in the Commonwealth. So folks aging, and it's not like the whole pot of people that are 65 or older, but there is a small subset in the aging population who are medically frail, who have perhaps experienced homelessness while they were younger, and when they get to be classified as an elder, they're exhibiting physical symptomology like they're 15 to 20 years older, just because life on the streets is so physically hard on your body. Families who are involved in child welfare. So there's emerging best practices around families being kept together. Instead of separating kids from their parents because of abuse, neglect, issues like that, keeping families together in supportive housing and wrapping around those services to every single member of the family. Youth, transition age youth, that critical age group between 18 and 24, kids aging out of foster care who do not have that sense of home with their foster family, supportive housing is a great intervention for them. Lots of great evidence around justice involved. So folks who exit prison who have a disability or a disabling condition, having supportive housing be that housing intervention, be that housing stability, which time and time again automatically, dramatically reduces the recidivism rate that your state pays for when someone reoffends and goes back into the prison system in Kentucky. IDD, that stands for intellectual and developmental disabilities. This population has been historically kind of out of sight, out of mind, put in an institution for hundreds of years. When the Olmstead decision came to pass with the Supreme Court, this call to integration and having folks with intellectual and developmental disabilities be afforded housing opportunities like everybody else. Supportive housing is such a great fit. Once again, assuring affordability, access to services which allow them to not be institutionalized. And last but not least, folks struggling with addictions and mental health, lots of time that's a clear overlap. People with severe mental illness using alcohol and drugs to cope with the symptoms of mental illness is a tried and true population that benefits from supportive housing. So you've kind of got your crash course in supportive housing 101 and have a sense about the needs. So where does CSH come in? Well, the Supportive Housing Institute is our flagship training series. We have 16 cohorts going on right now all across the country. Just a few weeks ago, we wrapped up the first Kentucky Institute, and this is a comprehensive, and I mean that seriously, a comprehensive training series where we take a development team that at a minimum is a developer, a property manager, and a service provider who work on creating supportive housing in real time. So there's slide decks, there's speakers, but there's also team time to work on the actual due diligence that is required of development teams as they queue up for their competitive application cycles. So it's 10 training days. We had our finale a couple of weeks ago. And then after the teams graduate, Partnership Housing on the Call was one of our recent graduates. These teams are afforded technical assistance through the first year of operations because there's so much learning that goes on after the training is over. This is really where you're testing all that you have learned in the training and putting it to use as you move through your permanent financing, as you move through your construction, your initial lease up, your first year of operations. So the contract and the expectation that we have with KHC and all of the teams that we serve is this technical assistance relationship to make sure that these development teams have everything they need to be successful through all of the phases of development. CSH is a lender. We have loan products that support mission-driven supportive housing development, and that's part of what we offer our development teams. And then advocacy. We've been working with KHC on a variety of topics that really are, what are some of the roadblocks that will prevent these teams from being successful, and focusing these efforts on kind of lifting those roadblocks to ensure that our teams can be successful. So, of course, our goal is to expand the production of units. It's actually bringing new units of supportive housing online. You saw the need slide. There's lots and lots of units that need to be created in the Commonwealth of Kentucky. And we're also talking about reducing incidences of homelessness, from individuals experiencing chronic homelessness to families experiencing homelessness. Really, as we build that pipeline, making sure that those incidences of homelessness are going down. We're, of course, working to stop that revolving door that when families and individuals are experiencing housing instability, we see this uptick in the cycling through these very expensive, poor outcome systems. And then, of course, last but not least, those folks who are exiting institutions like prisons, psychiatric hospitals, have a place to go when they leave. Those are kind of the cornerstones of why we are doing what we are doing. So while the Institute doesn't guarantee you funding, what we see time and time again is that the participation in the training, the technical assistance that is afforded them, this real team effort to bring units online, across the board, when you look at all of the Institute cohorts going on in this country currently and in the past, since CSH has been doing this, our teams, the Institute teams, are more likely to be funded right out of the gate than their peers who do not participate. So it really does set our teams up for success so that they figure out how to do it well, and are successful right out of the gate with their capital applications. So this is only 6 bullet points on this slide, but the Institute objectives probably are like 45 plus. But of course, that first and so important objective is to connect that target population to what supportive housing fidelity is all about, making sure our teams really understand the populations that benefit from a supportive housing intervention, really flushing out the roles of every team member, who is doing what and why, making sure that there's complementary roles on every team, making sure the team builds that sense of team, that mission, why are we here, and strengthening it, because what we know about any kind of development is you are in relationship with these people for a very, very long time. So anything that we can do to strengthen the team at the end of the day necessarily leads to a higher performing supportive housing project. We spend a lot of time demystifying the services. What services need to be offered to someone experiencing chronic homelessness? How are you going to pay for those services? What are the best practices in the service industry right now? Because back to that but-for rule, if the services are the secret sauce into assuring that people stay housed. And once again, that's that number one goal in supportive housing, is keeping people housed. You see bullet point number 4 here, tenant selection planning. So, we spend a lot of time on the pre-development and development, but we also look towards the future. What sort of items do you need to have in place as you start opening your doors? We spend a lot of time talking about the financing. It takes a ton of money to build these units. It takes a lot of money to operate these units. It takes a lot of money to service these units. So where are all those funds coming from? How can you be compliant with those funds? How can you braid these funds to make sure every team is well resourced so that they can offer up a high performing supportive housing unit for their target population? So at the end of the day, I mentioned the finale. Our teams present a 20-minute high-level overview of their projects. So each team worked on their supportive housing plan that really cues them up for all of the capital competitive applications that they must undergo to really have a complete budget to support the creation of those new units. They once again have access to funding if they need it, recognizing it costs a lot of money, and some of these funding streams aren't in play when they need them to be in play, so they have to bridge it with certain loan products. Overall, the Institute really does strengthen teams as they approach creating new units. It can help them troubleshoot issues that they have with existing units. And for those teams who are focused on integrated units, where that's only a small subset of the total balance of units that are dedicated to supportive housing, really making sure they're equipped to enter into the operations stage, eyes wide open about how to handle an integrated development. So, continuing here with some of the benefits, I cannot underscore enough the strength of the team, really making sure that the team is as strong as possible. And we watch this happen in real time as teams get to know each other, work on these items of due diligence together. And after 6 months of intensive training, you can see how the team has really strengthened and changed and positioned themselves to be successful long term. There's so much that I love that we could be in person for half of the sessions, because so much comes from being in a room together, that peer sharing, that learning from other people's experience, the learning from questions that other team asks. So, it's not just learning from CSH, but providing a space where folks can learn from the other teams. And then we're not leaving teams high and dry. We're there with the teams through that initial first year of occupancy to really position themselves for the next 15 to 30 years of operating compliance. So we just had our finale with 6 teams. 2 teams are proposing developments for the city of Louisville. 4 teams are positioning themselves for proposals in the balance of state. And we're launching our second cohort next winter, hopefully in January, which means the RFP, the informational webinar, and the application will be going live later this fall, early winter. So if any of you on the call are interested in participating, or you know of an organization or a development team that may be interested in participating, I will enter my contact information into the chat. Wendy Shop also knows how to reach out to the CSH office if you have any questions or you want to run a proposed idea past us. So with that, I can open it up to the floor to see if anybody has any questions.
If I may, I would like to share with the committee kind of how this institute that Leah has outlined embodies a couple of KHC's strategic directions. One would be for us to seize the opportunity of some of this one-time COVID funding to address long-standing gaps in our housing delivery system. So being able to fund permanent supportive housing for the folks who are hardest to keep housed has always, it's challenging, it's expensive. And so we have really seized the opportunity of the home ARP funds to use some of them, to hire CSH to consult and counsel KHC, but also to do the Institute, and then to use those funds to actually fund the development of permanent supportive housing. So that's one, patching, these long-standing gaps with this one-time money. Another strategy is to connect the dots within KHC for more optimal impact. And again, these projects that will come out of the Institute will connect KHC's multifamily funding programs, our homelessness programs, and our Section 8 voucher programs, because we're going to project-based vouchers in some of these projects. So that's a huge deal. You would think it would be easy for us to connect the dots across our departments. Let me tell you, it's not. I'm living it firsthand. And then the third strategic direction is for us to partner more with other parts of Kentucky. And so in particular, our partnership with Louisville Metro Government on this institute and the projects that are looking to develop in Louisville, we are talking pretty often with them about what they're going to invest, what our funding might look like, priorities and timing. And so that's just, to me, this embodies us really striving to get better as an organization.
Thanks, Wendy.
Can I ask a question?
No, go ahead.
My name is Ann Anderson, and I'm president of our resident council here at Willie C. Plaza. So when this whole pandemic thing started and everyone was trying to move everyone into housing, every available unit that they could get someone off the street into, they have put into. We are running into the fact that we want to be able to provide those wraparound services that you talk about, but we don't have the ability because we haven't been trained, and we don't, as far as the resident council, we don't have the facilities to do this. How do we partner that with whatever hoops we have to jump through with LMHA?
So I heard kind of several needs in there. One is training with service staff. Is that correct?
Well, most of my staff that I have here, which consists of a vice president and a secretary, besides my supervisor down at 8th Street and the property manager here, I would like to be able to provide wraparound services here, but I don't have access to any of the information. I don't know how to get all that here in order to, so that if someone has either been institutionalized by prison or by hospital or by homelessness, when they come in here and they have nothing, and we have to try to reprogram them back into what social norms are, that's where we're having a problem, along with the addiction problem.
Right. It sounds like the call to action in that example would be around service coordination, which you oftentimes see in all different types of affordable housing, where there's someone who is kind of dedicated for that information and referral. They get to know the tenants. So it's not direct service per se. It's not psychiatric services. It's not case management services, but it's getting to know the tenants so that when they know Mrs. Smith's about to be late on her rent, they know that there is a church that offers rental assistance, or someone's getting low on food at the end of the month. They know of the local food pantry that they connect them to. So the service coordination model is wildly effective and successful, and it works really well in senior housing and general affordable housing. But it is a service that is unique unto itself outside of supportive housing as a specific type of housing. But I'm happy to talk with you more about it offline if you want to.
Oh, sure. Please do.
I put my email address in the chat, so you could just reach out to me and we can schedule a time to talk.
That would be perfect. Thank you.
Sure. Are there any other questions for me? I see a hand raised, but I don't know who it's attributed to.
Yes, I'm Phyllis Parker, and I represent persons with mental health and disability issues. And my question is that I'm happy that you're there. I'm happy that you're coordinating services and providing the training and that sort of thing. My big question, which relates to what the lady before asked, is are you partnering with the agencies that have provided supported housing and have housing first models out there? And if some of the folks that are that have been pioneers in that area have been called to the table. My second question is it's good to have resources like food pantries and churches and those types of things. And I've been working with food pantries and churches recently. And sometimes they're really, really in a strain because there's so much need. So I would like to see some of that get addressed as well, because they're trying to serve the folks that are on the fringes, in addition to those that have real need. And that was my only question that I had is how are you drawing people to the table that need to be drawn?
So the minimum team composition to participate in the Institute and just to be able to successfully develop supportive housing is a property manager, a developer, and a supportive service provider. So you could have a development firm that has a property management arm that necessarily needs to partner with a homeless service provider, perhaps a behavioral health organization, perhaps a federally qualified health center, a community mental health center. They come in a variety of forms and fashions, but there is an expert at the table who provides services, who's savvy. You mentioned the housing first, who's savvy about housing first and why it's an evidence-based best practice. So there has to be a direct service provider at the table who is kind of the lead for the proposed project. And then you kind of build out your supportive services planning from there, recognizing that sometimes you need additional service providers because one organization doesn't offer all the different types of services that any one given person might need over the course of their tenancy. But that lead then brokers the relationship with other community-based providers to make sure that any and all services that tenants might need, there is a direct provider who can be used to offer that service.
And just to jump in, Phyllis, they're all local organizations. I mean, Kentucky based, so it's not, service providers from outside of Kentucky. And those that are, and they have to be one that wants to work on developing a property, right? Not just providing services, but doing that at a property that we're going to fund with this one-time money. So I can tell you, Welcome House has been one, Life Skills, Volunteers of America. I'm not going to be able to come up with all of them, but they are all Kentucky-based organizations that have a history of working in providing services to people experiencing or at risk of homelessness.
Wellspring,
it's been a wonderful conversation. I am so aware of the time and that we wanted to talk about our priorities at this meeting. So thank you so much, Leah, for presenting to us. I think it's been really informative. And I hope you stay for the rest of the conversation because we'll be talking about priorities. And I think it's a situation where anyone who has interest in it, we'd love to hear from people, whether, you're officially on the committee or would like to participate in that.
Sounds good. Thank you all so much for your time today. I really appreciate it.
Thank you. Thanks, Leah.
I know that we had on the agenda next to talk about the eviction relief or the prevention, but I'm wondering would it be all right if we switched to the priorities just so that we could make sure to get those in?
I think that'd be fine. Christine, does that work for you okay?
Yes, absolutely.
All right, thank you, Christine.
No problem. No problem.
So a month ago, everyone received an email and let's see, let me find it here. So Kay, Wendy, and I met and we thought that it was worth going back to the HPAC priorities and revisiting them. So to refresh your memory, because a month is a long time, we were all asked to think about 2 to 5 areas of top housing concerns for our area, for our community, or for our organization. And then to provide any recommendations where KHC might be able to most beneficially use the COVID relief funds that are coming out. So that's really just to jog everybody's memory. Wendy, did you receive any feedback from anyone? Or Kay?
Yeah, as of not, we had not received feedback. But we do have some comments and input from some of our community partners that we've worked extensively with as well. And that will also help spur some brainstorming and some ideas and some hand raising as well. So no worries.
Okay,
yes.
Great.
Bev, just so you know, Kay, in addition to asking the members what they, those questions, Kay reached out to some of our kind of key partners around the state, membership organizations, that kind of stuff, to ask the same question, to kind of figuring that HPAC members would want to know, well, what are you hearing from partners?
Mm-hmm.
So Kay, if you want to go ahead and share that.
Yeah, if we want to take just a deeper dive, as Wendy mentioned, I reached out to about 9 partners that KHC currently works with, and they are partners that are awarded what's called strategic operating grants. We refer to them as our proactive grants each year. And so many of these organizations represent advocacy across the state of Kentucky, and they serve in that role to support communities, outreach and engagement. And so I had a good 10 to 15 minute conversation with about 9 organizations just to say, I really posed the same question that I shared in the email. As you look to FY23, what are the priorities? What are the things that are pressing within your respective communities? And that can be a wide range. Some things may be similar and overlap, but looking at across the entire state, in which KHC's mission is to really serve, organizations in various parts of the state may have different pressing issues, right? And so it may not always be the same. And so what I did, based on those responses, I really put them into 3 categories. Much of the feedback and responses that I received kind of rolled up into 3 areas that we are seeing locally and nationally as well. A shortage of affordable units. We know that the pandemic certainly exacerbated housing instability for renters across our communities. And so also looking at eviction reform and kind of that power dynamic between landlords and tenants. And then thirdly, really focusing on barriers to homeownership opportunities. And so what I did was with those organizations, I kind of put together a list of a lot of various topics. Again, they all fall in those top 3 buckets, focusing on housing units, the shortage of those, as well as eviction reform and barriers to homeownership. But some of them drill down into more specifics. And so this is somewhat a list talking about that. One thing that was kind of a repeat issue as well was around homelessness specifically, solving that. And talking to organizations like HHCK and KCADV, they talk specifically about special groups, focusing on funds, extending programs that really looked at how we serve our special groups. And I think even, the Corporation for Supportive Housing Institute talked about, the medically fragile, the mental illness, even people fleeing from domestic violence. So really looking at safe spaces, supportive housing, non-congregate shelters, bridge and transitional housing units for our homeless population. Even aging out of foster care is another special group that has been on the rise since the pandemic. The Housing Institute also talked about the needs in Louisville, specifically a great number of our population, our needs and units are needed in the Louisville area. And so the housing needs assessment that came out a couple years ago drilled down on 31,000 units needed for those under 30% AMI. And so really, again, being able to serve and look at units, available units on the market for the extremely low income. Talking to our partners in the Eastern State at FAHI, they talked a lot, again, about serving the extremely low income, looking at more vouchers, not just the shortage of units, but putting more vouchers being available. And then looking at fair market rents. Some of the current rates are in areas that are not really safe for families and children. And so again, looking at those as well. Talking to our partners at Habitat, they talked a lot about Western Kentucky and the disaster recovery efforts there. And so again, those are communities with a great number of renters, and there's a loss of units to those communities as well. And so in that category, again, looking at a shortage of units, looking at how we can get those spurred back on the market. With that, again, talking about eviction reform, I talked to Tony over at MHC and Lexington Fair Housing. So Lexington Fair Housing is working very closely, of course, with Louisville and Lexington and other areas to talk about landlord engagement. How, again, do we spur getting more units? How do we look at the dynamic and the shift with tenant and landlord mediation, disputes? MHC is working a lot with like the coalition and legal aid to talk about the right to counsel programs, which are really pressing issues. Having more transparency around tenant protections, as well as background screenings, a lot more conversation around that as well. Another great need they talked about, it's great that we have this influx of funding, but what's next? Like, how do we identify new funding that will keep rent and utilities programs sustainable over a long period of time? Ashley from the Energy Cabinet talked and gave us some great information and charts about utility cost. And so looking at that and over the long term, how do we, again, continue to support households, low income that may be paying more for energy rates? And so looking at, again, eviction reform and measures to combat high rents and this power dynamic. And then the third category, again, a lot of concern around barriers to home ownership. We looked at in this last quarter for the 5th month, closing out in June, home ownership sales have dropped a little bit due to inflation, high interest rates. And then talking to the urban leagues, there's been a lot of conversation even around just development of affordable projects, looking at that there's a shortage of lots to be able to create affordable housing for families. With the rising cost and supply chain issues, it's really just outpaced families' ability to purchase. And so, what is the control and what are the pressures around acquisition, development, and even purchasing power for our families? And talking to Louisville Urban League, they talked a lot about concerns around first-generation asset builders Again, advocacy, education, and outreach. Looking at this 30-point gap between Black and white households, Black and minority and social groups with home ownership. How do we address that? How do we understand it? How do we have conversations about it? And so organizations that are already doing the work, being able to grow capacity, not necessarily needing new programs, but needing funding that we can limit the red tape. We can cut back on some of the policies so that we can get the dollars to the organizations that are doing the work to address these areas. Talked a lot, again, even with MHC, talking more deeply about working with the Land Development Code, looking at ways in which we can talk more about the regulatory issues around racism and inclusion in our history, and how do we move that to further fair housing. So all of these have been really identified as 3 areas of concern for FY23 across our community partners. Just understanding, all of these areas, who we serve and what are the barriers. So I wanted to take a few moments. I hope I didn't go over time, Wendy. But these are a lot of the feedback and the responses. A lot of them, again, are similar as kind of they roll up into these categories of concern. But I wanted to give, again, an in-depth list that really outlines what areas and what are specifics for some of our agencies and how they go into these categories. So I hope that helps.
So why don't we pause there and ask HPAC members, will you go back to the 2 questions, Kay?
Yeah.
Are there things that you all want to echo or add to based on what Kay has heard from some of our key partners? And maybe you could show those top 3 things, those roll-up categories, Kay. I will say that from KHC's standpoint, this is not a surprise. At least 1 and 2 are huge for us. We've never had more rent assistance or new Section 8 vouchers to help people get out of homelessness or prevent it. And we've never had a harder time finding a place for them to use that voucher. It's always been a challenge. It is just a cruel challenge right now. And I'll give you all an example that kind of shows it. We're allowed to let a voucher holder extend their search up to 120 days. So 4 months. We can keep extending how long they have that voucher. But 120 days is the max. So we have had I think it's over 60 people who have been experiencing homelessness, who get a voucher, which is like getting a golden ticket, and they cannot find a place to use that voucher within 4 months. And we have to rescind their voucher. It is just, it is the most awful place for us to be. I don't know if you all are experiencing that shortage in a similar or different ways, but it is a real challenge for us.
I'm seeing that. I work with people who are homeless, and I think I have 15 people right now with vouchers, and we look every day. So 2 concrete things I guess I would put on the list. I don't know how often fair market rents are raised. I know I saw on a TV news station that the Cincinnati Standard Metropolitan Statistical Area that rents went up 40%. I take it in the past year. So we are trying to compete with the vouchers against those odds. If there was a way to get fair market rents increased out of cycle, I think that would be helpful. And the second thing is when units are inspected, the time frame is fairly long. It takes 2 weeks, 2 to 3 weeks maybe, to have a voucher approved. And landlords don't want to wait that long, and they don't have to wait that long. And they lose, there's a $500 incentive if it's the first time they've ever rented with a voucher. But if an apartment is $1,000 a month and it takes 2 weeks, in their eyes, they've lost that incentive. So I'm sure staffing is an issue and distances are an issue, but if we could look at that, I think it would be very helpful. I see another hand raised, but I don't know who it is.
This is Phyllis Parker. I'm sorry, I don't know how to fix it. I have a new laptop and I'm just struggling today. I had a list, but then as we talked, I was wondering if we could take your list and have a chance to think about those areas and be prepared to submit any additional comments that we might have after the meeting. But my biggest concern was the Section 8 housing challenges, finding places, safe and affordable housing units that are really, really, really hard. And then how, when the eviction reform is important to me, and then the rental and then the utility assistance is important. But one of the areas that we've grappled with is how do we sustain someone once we've given them assistance? How do we make certain that how can we assist them in being able to keep on the level that they need to be on, and they're not, being set out to try to find additional funding for assistance somewhere else.
So Phyllis, are you kind of saying, like, if you can manage to get them stable for a minute, how do you sustain that?
How do you sustain that? Yes. Okay. That's the big thing.
I agree.
That's our worry.
Other ideas? Scott, I see your hand raised.
We've got to find a way.
Thanks. Yeah, I think for us, it's a cost is a huge. You mentioned that. I mean, our costs are up 25%. Our construction costs, and so that has two huge impacts. One is it makes it much harder to serve people both through home ownership and rehab, because for like the cost of the home goes up, so particularly the people on the lower income gets pinched. Same thing with rehab, but it's also a concern, if our units are 25% more expensive and there's not more money, then we're going to be producing fewer units, and we all know we need more units. And I assume we're not currently doing a rental development, but I assume rentals are facing the same challenges, that their costs are up. And so I think in all the ways possible to spend that COVID money to deal with that cost increase would be really helpful. And I don't know all your ins and outs, what you can and can't do, but that's a huge need.
Very good point. One of the disappointing things with the COVID funds is that really none of it was crafted to just support the development of generally affordable housing, whether home ownership or rental. It's all either rent assistance or this really targeted to homelessness home ARP, and we need that, but we already had a shortage, and then with inflation, we do need more funding just to support the general development of affordable units that aren't even targeted to specific populations.
So I'm aware that we're coming to the end of our scheduled time. And I guess I just want to check in, first of all, to apologize to Wendy and Christine that we couldn't get to the agenda items. But also, I see that some of the funding, there's a couple of years until it all has to be spent. The emergency housing vouchers are good like it's through September of 2023. So would it be helpful to ask people if they wanted to join a little work group in between this and the next meeting to kind of more finally craft these priorities? Or could we go by the type of funding and just send out a little meeting agenda for people who wanted to focus on those issues? Or, Wendy and Kay, I don't know if you've thought of other things, but.
Well, I love the idea of maybe having a couple of sub conversations that people can choose if they want to be part of. Particularly, Bev, you've offered some good ideas about the special vouchers that we have and what might speed up, what might make them more appealing to a landlord. So I would really welcome that for sure. That would be very helpful to me and my staff. But I'm open to the broader conversation too. And we are scheduled till 3:30, just so you know, Bev.
Oh, great. Okay, great. Do others have thoughts, whether about how to move this priority agenda along, or specific thoughts on any of these particular issues?
I will say we were hoping we would be in person to have this. It's easier to have this kind of organic conversation, and we might aim to revisit it. I think KHC would welcome, HPAC sharing some priorities, because you can't prioritize everything at once. Everything is important, but if we're going to focus on where we have some dollars or discretion and there's a great need, I think it's not a bad time for HPAC to make some recommendations. The committee hasn't for a couple of years because of COVID, and I'll be honest, KHC probably wasn't interested. We were just so up to our ears in mobilizing, but it's not a bad time to take a breath and have the committee say, if we had to tell you to focus on 3 to 5 things, these are probably the most urgent. Well, maybe we can continue it, Bev, particularly if we're able to be in person next time.
Okay. Well, if you pulled together an HCV little work group, I would be interested in joining you on that. And I thought from the conversations that perhaps the weatherization folk might want to get together too.
Now, I will, if we can, since we're messing with the agenda anyway, Bev, if we can move to the weatherization update, that might be a good time, because as you all saw on the chart, we do have a lot of weatherization dollars coming through the bipartisan infrastructure legislation, and we don't have any of that money yet, but I know Kelly has had a lot of conversations with our providers, our community action agencies across the state. So maybe we could let Kelly speak to that, if that's all right.
Sure, that'd be great.
Weatherization is always fun. First, let me just say that. And when you add $52 million to the pot, it makes it even more fun. Additionally, when you add $52 million to the pot and say, oh, you have to run the program the exact same way, except we're going to just make it harder, they just added more fun. So what I want to do today is really do a crosswalk behind the funding of weatherization. I know we kind of threw weatherization at HPAC, and we did a little history, but maybe you still don't understand all the funding and what it pays for and how it comes to us. So this is a really good slide to explain, here's what we have currently and here's what we're going to get. So right now we fund the weatherization program with 2 pots of funding, with the Department of Energy formula money and with the LIHEAP weatherization money. So our state gets an allocation of LIHEAP dollars. It does utility bill pay, and 15% can be carved out for weatherization. So we get that money from the Cabinet for Health and Family Services, while our Department of Energy formula money comes straight to KHC from the Department of Energy. Our funding from DOE formula is about $5.8 million. In LIHEAP weatherization, we get about $7.7 million. And with our DOE bill money, so this is additional money that we will be getting, it is almost $52 million. The grant periods for DOE formula and for LIHEAP weatherization run our fiscal year, July 1st through June 30th. So that's what those pots of money represent. The DOE bill money will be for 5 years. So we have 5 years to spend it. Now we as states are being told that if we are meeting particular benchmarks set by DOE at the end of 5 years, we will be able to get another five-year contract to spend the remainder. So really we need to target to spend 50% of that allocation in 5 years. For the budget plan, our state plans for DOE formula, they're always due the first week in May. For LIHEAP, that state allocation is due October. I think it's due really like in September, but the year starts October 1, so it's due in the fall. And they just had an LRC committee meeting about that plan the first week of July. And then the DOE bill money, we had to have budgets in July 1st, so DOE expected to give us our money already, but we don't have it yet. We were going to get 15% once our budgets were approved, but again, we don't have that yet. And then we have a state plan that's due October 1st, and then we will receive another 35% when that state plan is approved. The fun part that I found out today is because we don't have any money yet, we technically can't pay for planning activities. So this just gets more and more fun. Administratively, we get 15% on the DOE formula. We split that with our subgrantees. So we take 7.5% and give 7.5% to our subgrantees. We run that money through a formula. For LIHEAP weatherization, we get $770,000. It's about 10%. Again, we split that 5% KHC, 5% to our subgrantees. And then for the DOE bill money, that admin will be a total of $7.7 million, almost 8. And we will again split that 7.5%, 7.5%. The nice thing about our DOE money is if our agencies receive below $350,000 in an allocation, we actually can get them extra admin, up to 10% extra admin. So for the formula dollars, we can get extra admin to those agencies, the subgrantees. Our DOE bill money won't allow us to do that because the allocations will be over $350,000. We also are able to craft out training and technical assistance dollars in all of those pots of money. So our DOE formula, we get about $970,000 in training and technical assistance. That's how we keep our residential energy efficiency training center open and keep it staffed, is to use those dollars. And then what we don't use in that facility, we push over to our subgrantees. And with LIHEAP weatherization, we can use up to $1.2 million. We usually don't allocate that much just because we don't need it. The remainder goes to program funds. For the DOE bill money, that will be $9 million total. Our average cost per unit, so this is what we can use per unit for weatherization measures, and we aren't supposed to exceed that. For DOE formula money, it's $8,009 for FY23. For LIHEAP weatherization, we do not have an average cost per unit. We pulled that out of the state plan when COVID started, just because we knew our staffing costs were going to exceed what we could have for an average cost per unit. So that has helped our network tremendously as material prices increase and labor prices increase. For our DOE bill money, we have an average cost per unit of $8,009. That is for all 5 years. So that is going to make this a little bit more difficult to serve clients with that funding. For health and safety caps, so those are measures that are just typically address only health and safety. Smoke alarms, carbon monoxide detectors, sometimes it can be a non-operating HVAC unit, a non-operating heating hot water heater, could be a gas stove that's not working or venting properly that needs to be replaced. Those are all health and safety concerns. So we can use 15% of our DOE formula money. Our LIHEAP weatherization money has no cap on our health and safety costs, which we removed from our state plan a few years ago. And our DOE bill money is 15% limited. We usually do not have a problem as a state hitting that because we can push those health and safety costs extras over to our LIHEAP weatherization. We were allocated weatherization ready money this year in our DOE formula. It's $290,000. So we're crafting out for our LIHEAP weatherization program up to $290,000. Now we split that amongst 20 agencies. It's not a whole lot, but we do have that available, and we hadn't had that available in DOE formula money before. The DOE bill money does not allow any weatherization ready funds with it, and we cannot braid our DOE formula money and our DOE bill money. Back in AURA, you could put everything in one pot. We cannot do that this time.
Is now exiting.
So we don't have weatherization ready money available for DOE bill. We can use our LIHEAP weatherization, but again, that's limited funding. And weatherization ready is to repair deferrals. So if a unit is deferred, we can use that money to go in and repair the reasons for the deferral so that it can turn into a job completion. And we've been running a LIHEAP weatherization ready program for a couple of years now. It's been pretty effective. We spent around $42,000 this year. That ended up being about 15 to 20 units. But we have about only half of our subgrantees who are tapping in those funds. So hopefully we have awarded this now in formula as a formula. So hopefully that will encourage some of our other subgrantees who haven't been using the money to use the money now. Braiding, again, we can braid a DOE formula and with LIHEAP weatherization. We can braid DOE bill money with LIHEAP weatherization or any other private dollars, but we cannot braid those two funding streams together. Program policy, we are not changing DOE formula. Our LIHEAP program policy runs the same as DOE, except for a few exceptions. Those are savings investment ratios, which is kind of a scoring on energy audits, average cost per unit, health and safety caps. Everything else pretty much runs the same. On DOE bill, we will run it similar to our current weatherization program, but we will make just a few slight changes. But mostly those changes are just to enhance the program and do a few things that might enhance the program down the road, let's say 10 years down the road. Other requirements, Buy American. So surprisingly, in the last month, the DOE has decided that the DOE formula money is subject to Buy American, which it hasn't ever been before, but apparently it is now. But this is public building only. So only if we are doing a public building do we have to adhere to Buy American standards. LIHEAP weatherization doesn't have any Buy American language. DOE bill money has Davis-Bacon for multifamily units over 5 units. Buy American for public buildings only, and we do have to incorporate some type of Justice 40 language. So those are kind of the differences. So right now my team is heavy into the DOE bill planning. Our DOE formula grant was awarded and approved. The state plan was approved in June. So those contracts are out with the subgrantees. The LIHEAP contract we signed, I don't know, Wendy, back in February or March. So that went into effect July 1st. So those dollars are out, and we should be getting a modification on that probably in September-ish for some rollover dollars. So we should be good with that funding. It's the bill planning that we're kind of in heavy stages of. So here are some of the details. We talked about Davis-Bacon and Buy American get triggered in the bill. We cannot braid funding. We plan to run it similar to our current program because we don't want our subgrantees to have to actually learn something new. So technically it will be very much the same, maybe a few policy differences, not much. We will send out contracts to our agencies on the bill money once the state plan is approved, because we don't know exactly what we need to put in that state or what to put in those contracts yet, because we don't know what's going in the state plan. And subgrantees are going to receive annual contracts. So although it's 5-year funding for our financial systems, we're going to do annual contracts as long as they are performing and meeting benchmarks. They'll get just the rollover dollars and we'll move on with life. So that's kind of how that's going to work each year. Some of the other ideas that we are just kind of tossing around in our heads, maybe doing first one that we really like is to do a performance pool. So to hold out some of our dollars for a performance pool for subgrantees who are performing well, running out of money, we would give them additional awards. If we don't meet benchmarks by year 3, then we would open up that performance award pool to other nonprofits and do an open application, because we do feel like maybe our subgrantees might not have capacity to spend this much money plus their formula money plus their LIHEAP money. So it may be a need that we need to pull some other contract with some other nonprofits to help us roll out these dollars. We also are going to upgrade some technology. So we're going to look at doing online applications and what will it take to do that. And we do have that capability with our new software system that we implemented July 1st of 2021. We also want to look at how we can use electronic signatures with software to make that a little bit more seamless. So really thinking about the things that tripped us up a little bit with COVID, when COVID started, how can we eliminate that going forward? We also are looking at, can we build in contractor incentives? So an incentive to keep contractors working for us. So maybe some retention bonuses, maybe some EB-WEB incentives to build in some diversity amongst our contractors. Our agencies really, subgrantees really supported us kind of building a career path with these dollars and figuring out how to do some maybe minimum wages set as for certain positions within weatherization, and maybe even creating an outreach team to help us go out and gather applications. I gave the statistic earlier. We had about 442 job completions this year, but we have 440 deferrals. So for every job completion we received, we also had a deferral. So we have to figure out a way to really kind of broaden our scope on applications. We also might tap into solar and figure out how to do a few solar projects, maybe even applying for some other DOE funds to help fund that, but building that into the state plan. So really trying to think about how we can address some issues that may be more futuristic, maybe 5 years down the road issues, but how can we use that money to start planning for those? So that's what's going on with the bill dollars. And I'll open it up for questions because there might be a lot, because it's a lot of money.
I have a question.
Sure.
Some agencies are saying they've run out of the LIHEAP money.
Mm-hmm.
How do they apply for more?
Is it LIHEAP energy assistance like for bill pay or LIHEAP for weatherization?
Bill pay.
For bill pay, yeah. So the way the state funds those LIHEAP dollars, this is how they fund LIHEAP weatherization. So I think it's the same for LIHEAP bill pay. They give us 25%. So our LIHEAP dollars federally are awarded October 1st through September 30th. Our state fiscal year runs July 1st through June 30th. So that first quarter of the state fiscal year is actually the last quarter of our federal fiscal year. So the way the state awards the contract is they give us 25% starting July 1 to run us through September 30th. And then the theory is October 1st, you would get another funding cycle. So we really get a very small amount July 1st through September 30th. So I know it's possible to run out of money because we are tight on weatherization dollars right now. And we can't get more until that next federal fiscal funding contract comes out. And sometimes we don't get those dollars for a little bit.
Phyllis, if I understood you, you were actually asking about funds to help people pay their bills.
It's the LIHEAP utility bill pay, yeah.
Yeah.
Well, those don't come through KHC at all, Kelly, correct?
Yeah, that's correct. Okay. They don't come through us. I think the funding cycle is very similar to what ours is, where they only get a small amount to run them for 3 months, which is probably why you're hearing that they're running out of those dollars, is because it's not a very big portion of the overall yearly funding.
Okay.
Yeah. But don't forget that KHC does have utility bill with our HHERF, right, Wendy?
We do. If you have a tenant that is behind on utilities, it's actually, but we do not serve Jefferson County with utilities. And Phyllis, we can talk in detail about that if you want to, but anybody outside of Jefferson or Fayette County with utility issues can apply to Healthy at Home eviction relief if they're a tenant. If they are a homeowner behind on their utilities, they can apply to the Homeowner Assistance Fund that KHC is overseeing. Our Homeowner Assistance Fund is for all 120 counties, and that includes mortgage, property taxes, home insurance, and it can include utilities for homeowners.
But do you have to be affected by COVID to apply for those funds?
For the homeownership assistance, it is pretty stringent about the COVID impact because we're helping to pay people's mortgages. Sure. It's a pretty, that is Treasury requirements or legislative requirements. For the rent assistance, it is just you have to be impacted during the pandemic, not due to the pandemic.
Got it.
Okay. Well, this is outside of Jefferson County, so I will talk to them.
Absolutely. Yeah. And when Kay or Carla will send this PowerPoint out, we have a slide, I think it's near the end, that has the links to the rent assistance program, which includes utilities, as well as the homeowner assistance program. So we'll send that out to everybody and make sure you guys have that.
Okay.
Any other questions on the weatherization bill funding? All right, well, it's a work in progress. If you guys have any ideas that might help us, let us know.
Thank you.
Thanks, everyone.
Did we want to have Christine do her presentation and then decide next steps?
I think it's unfair to her to expect her to do it in 5 minutes or so. It's so that we have time for the rest of the agenda. We may want to, I hate to do it to you, Christine, but we may want to just postpone it so she's got a little more time than that.
Got it.
Let me just say, as a preview for whenever Christine does get to present, with our Healthy at Home eviction relief, beginning in February, Christine has piloted an eviction diversion program where she has some staff in the courts and she has file processors who expedite rent assistance for folks who are in the midst of an eviction case. Healthy at Home eviction relief can help anybody who's behind on rent, but we fast track folks who actually have an eviction case underway. And her team has managed to get payments out to landlords within 7 to 10 days, which is pretty lightning fast for a federal program. I would love for her to talk more in detail because it's a really great pilot that we've never been able to do, but we'll save that for another HPAC meeting.
Thank you.
All right. Well, thank you. And so what would be next steps in terms of HPAC priorities? Do you have thoughts, Wendy, or do you want to take what's been given and we could ask people to send in ideas? We could do another call.
Well, so I love the idea of an EHV subgroup. Maybe there's a priorities subgroup and we schedule it and then see who wants to, or we ask who's interested in being part of maybe a subgroup to draft like a formal recommendation of priorities.
Is everybody okay with that?
Yes.
All right. So let's take those next steps. Then we'll do an EHV target group, and we could maybe send it out, Wendy, I don't know, to both agencies that are helping people get vouchers, as well as, I don't know if there's any landlords who'd want to give some input. And of course,
that's a good idea.
Staff. And then, so for the overall policy priorities, that you and I can put our heads together and figure out what next steps with that would be.
Mm-hmm. Or Kay McAfee could maybe send an invite out to ask who's interested and then try to schedule that based on availability.
Okay. All right. Any other thoughts or comments on that? Are there any other informational items or announcements that people wanted to make?
What about the KHC conference coming up?
Oh, thank you for bringing that up. I really appreciate that, Wilma. I should have thought of that. We should have had a slide for that to promote it. Yes, we're so out of practice because we haven't had a conference in a couple of years. We are finally having our affordable housing conference in September. I'll have the dates for you in a second. I believe it is September 20th. Well, 21st and 22nd is really when it's happening, and it'll be at the Galt House in Louisville. I know that coincides with a FAHI conference, which just stinks. We have a new communications director and just didn't think to check all the dates. But if you can attend, we would really love to see you. And we're banking on us all being able to see each other in September. Thanks. Kay just put a link in the chat. Thanks, Kay.
Are there any suggestions for agenda topics for October's meeting? All right, well, if you think of any, you could send them to Wendy, Carla, or me. So without further ado, do I have a motion to adjourn?
So moved.
We have a motion and a second.
Second.
Thank you. And we'll see everyone in October, maybe this time really.